I see college students in my clinic just as much as I see healthcare workers, and I often see the college students of healthcare workers, which just further compounds their stress, honestly. But, college students are another population that have long been struggling with their mental health. It's a time of transition. It's a time of trialing new things. It's a time where lots of mental illness comes out for the first time. And if you add the stresses of what has become a new environment over COVID, it's been quite hard for people. I think that we have this view of what college is. It's in movies, it's in television. You look forward to it for a lot of your life. And then if you transition and it's all online or you're at home, imagine what a letdown that is. It might not feel like the biggest letdown to people when they think of all the other stresses in the world, but it's really important to them to have that experience, to get to have college like everybody else. And it feels very different. The other thing about that age group is they plan out everything. They know, like, I'm going to take this class next semester, then I'm going to go abroad, then I'm going to do this internship, then I'm going to, and you can't do that in a pandemic. You can't plan, and you don't know what not having that internship really means. Someone can tell you that it's fine. Everybody's not going to have an internship. You're going to be equivalent to them. But in a highly competitive culture where competition and that really drive for success has really contributed to mental health problems to begin with, having that added and not really knowing and nobody being able to give you answers, I think really matters. I think also with college students, a lot of what you get from being in college is from other people and from socializing. And even before the pandemic, that generation, Gen Z, is the loneliest generation, and people wonder what that means because, again, they have social media, they're around each other. How can you be lonely? But I do think it's still a lot of these things where we're just not talking enough about what they're struggling with, being vulnerable with each other, connecting to each other over the things that they're really dealing with day to day. And when you're not in the same environment because schools are online, or you're at home, or you're only allowed to interact with a small group of people, or then when you come back to school like it's been lately, it's just a hard transition. I think that all of that has just made it a lot harder for people. You don't even know what to ask because people have different experiences and you don't want to ask the wrong thing. And college students take everything really to heart and care a lot about the world and what the world's struggling with, and care about racism and climate change and all these other things that are contributing to mental health. And so that only makes it harder for them with all of this going on.